We're going to be talking about the results of the diabetes prevention program, specifically the role of activity over the entire course of the DPP and its outcome, so all the way out to 15 years. We have never investigated thoroughly the role of activity within this study. And we are showing for the first time that over the 15-year course, physical activity was significantly related to the development of diabetes, inversely related to the development of diabetes. In the study as a whole, and particularly in those people that were inactive to begin with. The take-home message, several that are very important. One is, since activity is a hugely important part of this whole lifestyle program, and it's not just about weight, to encourage physicians, healthcare providers, to start asking about and encouraging and supporting change in activity. The other piece to this is a former doctoral student of mine has published in Preventive Medicine, Eagle House, last year in 2015, that there are many community interventions now based on the DPP, the NIH-supported DPP, that show that weight changes. Now they do the two goals of the DPP were 150 minutes of activity minimally, just kept pushing, and to lose 7% of your body weight. But yet, and everyone in all these community interventions will do, those are the two goals, and then at the end of the day they report on weight. In fact, it's a little over half that are reporting on activity at all. So I think we need to take it a little bit more seriously. That's the take-home message. To be more active, it's setting reasonable goals. Now you're getting to be, tracking how much activity, logging how much activity. I remember one of our hardest participants said she couldn't do it, and I said, well, what can you do? It's always about what can you do? Well, I could probably walk 5-10 minutes a day. I'm like, then start there. And it's sort of getting over all these barriers of I can't run, I can't, who said anything about running? I can't do an hour. Who said anything about an hour? Do what you can do and then just start working up. It is a challenge. It is a challenge. I think the thing with activity that everyone has to get is, we're focusing on diabetes, we're focusing on heart disease. There's so many more reasons to be active. And so it's just this bargain. That is enough for the bigger picture. I mean, we've got to get people on this progression. And so, yeah, those things are all wonderful. Some people like them, some people don't. It doesn't matter what you do as long as you start moving more. And it's a balance. You've got to watch it's all a balance. We never say never to anything. We just ask people to move more, think through what they're doing, balance. So there's a lot of talk, if you will, about sitting too much. A lot of my former research has focused on translating our lifestyle intervention from the DPP into the community, and we and others have shown it to work. It's worked everywhere. We're publishing in the military, we're publishing in community settings, and we're publishing in work sites. Okay, so it works. And by works, there's weight decrease in activity change and a lot of nice diabetes and metabolic risk factor changes. So now the question is, what if you, instead of diet and 150 minutes of Surgeon General moderate activity, what if you did the weight loss and the diet and sat less? So change the sitting behavior. Our new clinical trial is looking at the impact of that on all these risk factors.